So it is my great pleasure to introduce to you our next guest speaker. She's also, I should tell you, has a dual role here. She's the guest speaker and also the timekeeper. So if you're the timekeeper, who's keeping time for you?
I have what's about me.
Okay, well, we'll make sure we assist you in that regard. Sadie Hinkel is the program director at the Alzheimer's Association Nebraska Chapter. She has extensive experience working in public education and advocacy and is passionate about providing and enhancing care and support for those affected by Alzheimer's disease and other dementias. Let's give it up for Sadie. Sadie, thank you.
Thank you, Dr. Masters. And you've been complimenting people all day, so let me compliment you that you have a lovely energy and a really lovely voice. You have a great presenting, just affect. It's the teacher in you, I'm sure. But yes, per that lovely introduction, my name is Sadie. I am the program director at the Alzheimer's Association's Nebraska Chapter. And today I'll be speaking not for too long, but really what I want to cover is the impact that Alzheimer's and dementia has on our state of Nebraska. But before I do that and I get into those statistics, which actually will lend themselves really nicely to everything Gina just covered, and it'll be a nice preamble to Diane Hendricks' presentations, because I know she'll get more into dementia and Alzheimer's. Before I get into those statistics, I wanted to just briefly go over and talk about who the Alzheimer's Association is, what we do, and really how we can help. So as you can see, this slide is a little hard to read. That's okay. I'll talk through it. Our vision at the Alzheimer's Association is a big one, the biggest one I would argue possible for an organization such as ours, which is a world without Alzheimer's and all other dementia. I will tell you, when I first started at the Alzheimer's Association, I didn't believe that that was possible. I didn't know really that that was a possibility. And now that I've worked at the association for nearly a year, I'm really hopeful that that will, happen sooner rather than later. Of course, it's an ongoing process, but we have people dedicating their careers, their lives to making that a reality, and a much needed one, right? So our mission is to really fulfill that vision to end Alzheimer's and all other dementia through a variety of things. The first is by accelerating global research. So you may know this, but the Alzheimer's Association is a national organization. That's great because they provide lots of studies, lots of data, statistics we can pull from, lots of resources, and that also allows us to do really good research on a global level. That is done nationally, but what I'm really passionate about and what I believe greatly most benefits Nebraskans is the work that we do at the local level. So what we do is we drive risk reduction and early detection. And I don't want to take away too much from Diane's presentation because I know she'll get into some of these things, but now more than ever, we know that there are benefits to early detection of Alzheimer's disease and other dementias, and there are good risk reduction strategies that we can take to, number one, just age better, live healthier lives as we become aging adults, but also to help prevent our risk of developing cognitive decline. So we educate individuals on those topics, and we also provide what we call quality care and support. So as the program director, I oversee lots of different free educations that happen across the state that might be, part of those early detection strategies. It's really important to educate individuals on the warning signs that people have when they have dementia or Alzheimer's disease. It might be just general understanding Alzheimer's and dementia. We educate individuals on those topics because if, like me, you may have noticed, and it's probably not a may, but you have, I'm sure, noticed the stigma that surrounds Alzheimer's and dementia that exists certainly nationally, but locally, within our families, within our friend groups. And sometimes that stigma isn't even noticed. To me, that stigma often manifests in people not being willing or able to recognize those warning signs because of the fear, because of maybe the fear of judgment, maybe just the general lack of information surrounding Alzheimer's and dementia. So what I do and what the Alzheimer's Association does that I'm really passionate about is just opening up conversations. And in my opinion, my background is in public health and education in general. I believe education is our best tool to combat that stigma, and in general, just awareness surrounding Alzheimer's disease and other dementias is very, very important as we move forward and, you know, work to fulfill our mission. So that's why I think what we're doing today is so great. I'm really honored to be here and presenting, and just by creating space to have these conversations, we're doing a lot of good work, because a lot of people in a lot of professions are not talking about these things. So to keep them forefront of mind is really important. And so this is why I wanted to come today with what we call our facts and figures report. So I'll start first with our national data. Gina gave some really, really great caregiver specific statistics. Those, I will note, are all caregivers. This would be caregivers specific to those caring for someone with Alzheimer's or dementia. And you've already heard me use both of those phrases quite a bit, Alzheimer's disease and dementia. Just an important note that when I say dementia, that's an umbrella term, whereas Alzheimer's disease is a specific progressive brain disease. The reason we hear those two terms used interchangeably so much is because Alzheimer's disease makes up the most dementia cases that we see. And we'll learn more about that later too. But when we look at these facts and figures, there's a lot up there. I won't go through every one, but I think it's really important to note that our latest facts and figures this year, that came out in 2024, highlights the fact, and this is not a surprise to anyone in this room, especially since, Gina, that was a great preamble to my presentation here. It's not a surprise that we know caregivers are struggling. Caregivers report the stress of caregiving, and I'll get into Nebraska specific statistics here in the next slide. But, you know, it's really hard to not only live with Alzheimer's or dementia, but to be a caregiver for someone with Alzheimer's or dementia. So that's really reflected in our facts and figures. A couple that I want to note, that I always note, is that 1 in 3 seniors dies with Alzheimer's or another dementia. Again, we're seeing now more than ever a bigger aging population, which is great. People are living longer, hopefully better lives. But the number one risk factor for developing Alzheimer's or dementia is not family history or genetics, it is simply age. So the longer people live, the more people we have living longer, the more we're going to see people living with Alzheimer's or another dementia. Right now, that number is about 1 in 3 people age 65 and older in the U.S. Are living with Alzheimer's or dementia. I like to bring that up too, because that number kills more people than breast cancer and prostate cancer combined. The reason why I like to use this example is because when I think of breast cancer, I think about the fact that 50, 60 years ago, women did not know that they needed annual mammograms. They did not know the importance and value of self-exams. And gosh, last month I went to a Creighton game and the entire arena was pink, right? My mom is a breast cancer survivor. She, benefited from early detection. She lived. She has a pink ribbon on her car. She has a million pink ribbon t-shirts and sweatshirts. And so I would love to see and work every day to see that same thing happen with brain health. That awareness is really because of public health education, and that's what we need to see happen with brain health surrounding Alzheimer's disease and other dementias too. So some Nebraska specific statistics for you here. Again, I don't have to tell really anyone in this room or online that Alzheimer's and dementia is impacting our state in really large ways. I think Gina used the word staggering, which I will steal from her, because when we look at these numbers, I just think about how much Alzheimer's and dementia is costing us. Of course, we know it's expensive, right? There's a financial toll for sure. But when I look at these numbers, I think about the singular person behind each of these numbers, right? These numbers represent people's entire lives. And there's lots of people in Nebraska affected by it. So in our state, this is also from 2020, which is our most recent data. There are 35,000, just over 35,100 individuals aged 65 and older with Alzheimer's disease or another dementia. That makes up about 11% of adults over age 65 in our state. Of course, it's not just the people living with Alzheimer's or dementia who are impacted. Alzheimer's disease not only affects that individual, it affects their entire family. It affects, sometimes their entire family's legacy if we're talking about memories and storytelling. And so there are 40,000 caregivers in Nebraska. Again, this is specific to dementia and Alzheimer's disease. That 40,000 number equates to about $62 million in total hours of unpaid care. And I always struggle to read this because it's so many zeros, but it's about $1.2 billion in unpaid care. So again, really similarly to what we just heard with the caregiver tax credit bill, we know caregivers are putting in a lot of work, and that shows in our surveys with their own health. So caregivers with chronic health conditions, 57.6% of them reported that they have their own chronic health condition. Again, a lot of these are sandwich generation caregivers. A lot of these are, maybe aging adults themselves who are caring for their spouses. 25.4% of caregivers in Nebraska reported that they are living with depression. Again, this is from 2020. I anticipate that number to be higher. And also for any of these things, with any, statistic ever, I suppose, that has to be either diagnosed or self-reported, right? And so we know some things are falling through the cracks as well there. And then 13.2% of caregivers live in poor physical health. So as you can imagine, it's really hard to be a caregiver to someone living with Alzheimer's or dementia, especially when you have your own health issues that you're dealing with. So when we're looking at Nebraska specifically, and we're looking at our workforce, there's, as you can see, a lot of room and a lot of work that kind of needs to be done. So right now, as of 2021, I should say, there are 23 geriatricians in Nebraska. There needs to be a 265.2% increase to meet the 2050 demand that we anticipate. Again, we're going to see more people aging than ever before. That's a trend nationally, not just in Nebraska, but we anticipate that happening in Nebraska. With more people aging, we're going to need more people who specifically can provide those individuals care. So that's where we're at right now. And there also is 12,500 home health and personal care aides as of 2020. To meet our 2030 demand, we'll need to see that increase by about 21.7%. So this is, all of these things, all of these statistics, I think can be disheartening. I, again, like to come at any kind of situation, especially in terms of education, with the caveat that these things can be done. We can put research and concerted effort behind these things with making our workforce better. But as of right now, there just needs to be a lot done with it, and so that's why I believe education to be really important. So when we look at healthcare, I won't go through all of these things because I got my timed reminder that I have a couple minutes left. But again, you'll just see that there is a large population of people who are in our healthcare system with that primary diagnosis of dementia. So as of 2017, that was 1,648 individuals in hospice with the primary diagnosis of dementia, which made up about 18% of all hospice all hospice residents. 18.7% of dementia, or is that dementia patient hospital readmission rate. Medicaid costs for people caring with Alzheimer's in Nebraska was $372 million. So there's lots of different things there. When we look at the mortality, the number of deaths from Alzheimer's disease as of 2021 was 687, which is the 7th ranked cause of death. So Alzheimer's disease and dementia in general are certainly impacting our state. We know that it's impacting us financially. We know that there's lots of gaps in care for several different populations of people. But when we talk specifically about who is most at risk, I always like to point out that Black Americans are actually about twice as likely as white Americans to have Alzheimer's or another dementia. And Hispanic Americans are about 1.5 times as likely to have the disease as white Americans. Likely that is because of health gaps and disparities for people living in those communities, not receiving proper access to care. So there are certain populations at a higher risk, and you'll also see on there that almost 2/3 of Americans living with Alzheimer's are women. Likely that is because women tend to live longer than men, and with that number one risk factor being age, then that kind of makes sense. But isn't that just the way it goes for women? But with all of that in mind, again, I'll end just with the message that days like this, trainings like this, are vital to any kind of improvement in our system. And it's people in these rooms opening up conversations and then carrying those conversations on that really can make that change. So I encourage you to stay involved, to learn as much as you can about Alzheimer's and dementia. We're going to have some really great sessions later today that go more into detail on these things so you can learn more. But yeah, thank you so much for having me here today. Do we have any questions?
Sadie,
Yes.
thank you. We just have one quick
Sure.
question.
Yeah.
The one quick question is, does the Alzheimer's organization provide training for family and entry-level caregivers for validation and reality training? Do you know of possible training opportunities?
Yes, so we provide lots of training for either general community members, but we also have an Empowered Caregiver series, which is for that informal family caregiver. So there we have lots of information on that too. I should mention, if you go to alz.org, you can read all of our resources. We also have a helpline. It's 1-800-272-3900. Any questions can be asked there. But if anyone is interested specifically in training in Nebraska for your friends, your families, your church, your business, your staff, they can reach out to me directly and I can get them help.
Sadie, could you repeat the contact information
Yes.
for our interpreters, please?
Yes, I talk quick. Our helpline number is 1-800-272-3900.
Thank you.
Yep.
Thank you very much. Let's give it up for Sadie.
Thank you, guys.
Thank you. This has been a good presentation. Thank you so much.